Welcome to the Diabetic Mogul Podcast. Pleasant greetings to everyone listening. This episode is based on the 2018 ISPAD Clinical Guidelines for the management of type 1 diabetes in school, and it draws up ISPAD Position Statement on diabetes in schools of many countries. Therefore, for communities without one, they should consider following these recommendations. The principles of Position Statement on type 1 diabetes in schools should be applicable globally. This episode strongly supports compliance with legal protections for children and adolescents with type 1 diabetes to attend school, to be safe at school, and to receive optimal medical management at school and in all school-associated activities. Basically, a background of type 1 diabetes is a complex medical condition that requires skilled medical and psychosocial management, intensive insulin therapy, which is the recommended therapy for young people living with type 1 diabetes because it leads to improved health outcomes and reduced risk of short-term and long-term complications. This comprises of frequent blood glucose or sensor glucose monitoring, carbohydrate quantification, insulin dose calculation, insulin administration with meals and nutrition adjustments for the physical activities. The important role. Now we'll move on to the important role of schools. 1. The student with type 1 diabetes spends a substantial amount of time away from the security of home and family supervision. The usual school day comprises many variables that influence blood glucose levels, the various levels of learning, meal, snack times, excitement, stress, peer interaction, and physical activities. These all impact or have a strong impact on the blood glucose levels. So the optimal management of type 1 diabetes during school times is essential to reduce the ever-present risk of short-term complications, especially low blood glucose levels, which is the hypoglycemia of type 1 diabetes, and reduce the risk of long-term complications, whilst enabling the student to participate, to perform, and to learn the best of their ability. And all school personnel and out-of-school hours care staff must receive appropriate diabetes education, develop a clear understanding about basic school-related of type 1 diabetes needs, and appropriately manage the effects of low and high blood glucose levels according to the written instructions from the parents and the medical team. And now moving on to the student and family emotional health part. This is a very critical segment. School personnel must understand the emotional burden experienced by families when given a diagnosis of an incurable disease such as type 1 diabetes that will relentlessly impact upon the student, the siblings, the family relationships, and the parental working hours. A diagnosis of type 1 diabetes may cause students to feel different from peers and put them at risk of being stigmatized, resulting in a higher risk of experiencing anxiety and depression. And the traumatized family may feel helpless and disempowered, and yet have an obligation to advocate for their child. And each family will have access to different resources. This is a reality, coping skills, and economic circumstances. So the school personnel will have varying interests and levels of expertise. Hence, care for the student must be individualized. And the student medical requirements and blood glucose targets are best determined by parents and the student medical team. And the privacy of student and the confidentiality issues relating to the student with type 1 diabetes must be respected, acknowledged, and discussed with the student and the parent, because this is very critical. Now moving on to the cooperative and the supportive partnership that we encourage. Caring for a student with type 1 diabetes is best achieved through a cooperative, supportive, and respectful relationship between the three key stakeholders, which is the parent, the school personnel, and the medical team. Then the student with type 1 diabetes should not be disadvantaged in the quality of type 1 diabetes care whilst at school. It is essential that the quality of diabetes management during school hours is comparable to the student's usual diabetes management at home. Each student should have a written individual diabetes management plan prepared by the parent or the student when they are capable. And the student's medical team, The plan communicates the medical orders for the student and is the foundation for the cooperative relationship between the parent, school, and the medical team. Now, we look at the legal issues. The World Health Organization recognizes type 1 diabetes as a disability, and now many countries have recognized type 1 diabetes as a disability in common law. Legal frameworks, they exist to protect the children and the adolescents with type 1 diabetes to ensure the student has an equal opportunity to participate in all aspects of school life. Schools in most countries are obliged by the law to make reasonable adjustments to facilitate prescribed medical care to allow the students with type 1 diabetes to participate in education on the same basis as their peers. This should become the standard in every country despite challenges in less resourced countries like Zimbabwe, South Africa, Botswana, etc. Schools have a duty of care for their students, and school personnel have a responsibility to take reasonable care to protect them from reasonably unforeseeable harm, including out of target range, blood glucose levels, and from discrimination, bullying, stigmatization, which have a significant impact on self-esteem, motivation, and emotional health. Now, the school personnel can be assisted to meet their compliance obligations by education about type 1 diabetes, appropriate training by the parent or the medical team according to the individual needs of the student, authorization and consent by the parent, and acting within their scope of practice according to the training and the consent they have received. Training of the school personnel. Now we look at the following levels of education and specific training which are recommended are: level 1, we have all school personnel should be educated about basic medical understanding of type 1 diabetes, including recognition and agents of treatment for low blood glucose and the effect of type 1 diabetes on the student and the entire family, including the social, economic, and emotional impact of living with type 1 diabetes. Level 2, those school personnel most responsible for the day-to-day management of the child with type 1 diabetes should be trained to recognize low blood glucose symptoms and signs, initiate treatment for high or low blood glucose levels, and to know and understand when and whom to call for assistance, including emergency responders, parents, and medical team. Level 3, those school personnel with authorization or seeking authorization through training and informed parental consent to administer insulin require a higher level of training on insulin administration, insulin dose calculation and adjustments, the legal aspects of insulin administration, insulin delivery devices, including insulin pumps, if we have them, and the glucagon administration, or suites, whatever that is they have. Lastly, I think we'll now look at the stakeholders' roles and the responsibilities. Firstly, the responsibilities of the three main stakeholders are: firstly, we have the parents. The parents are ultimately responsible for the medical decisions made on behalf of the child. Therefore, the parents' informed consent and decisions regarding the health and well-being of their child are paramount. It is imperative that parents remain engaged as part of the team, even when the student with type 1 diabetes reaches adolescence. Secondly, the student's treating doctor or nurse practitioner is responsible for prescribing medications. The medical team is responsible for outlining in detail the recommended medical requirements for that student. The medical team usually comprises a doctor and a diabetes educator and may also include, if available, dietitians, psychologists, social workers, exercise specialists who work directly with the child and the family. And the third, which is the last, the school and the authorities responsible for managing schools are responsible for executing the parental and medical orders outlined in the student's diabetes management plan and the facilitating the training of the school staff to ensure that they are competent to execute the care plan recommended by the parent and the medical team. So basically, those are the very, very key structures. Those are the steps that should be taken to make sure that people or children living with diabetes should have a good quality care of life whenever they're at school, because most of the times they'll be at school and not with their families. So the the care of diabetes is an ongoing and should not stop, and should not be only regarded as important when students are at home, and should just be continuous without any compromises, because one compromises can claim a life for people living with diabetes. Imagine if a child with diabetes has missed a dosage, it becomes very difficult to maybe correct that instance. So living with diabetes have a good quality life and they can lead a healthy life. Thank you so much for listening.